Fashion is an industry built on illusion, and publicity is a profession built on spinning the truth. But I'm a person who's become well known for being honest at any cost, whether that means stoking the fires of my own Fashion Week scandal or telling models that they're too thin. I don't regret speaking out against hypocrisy, though in this instance, and in many others over the years, it wasn't exactly the easy road to take. Society wants you to participate in its lies, but I've seen this produce terrifying consequences in fashion, from drugs to anorexia to abusive relationships. We tend to spend our lives building a stable of partners in our crimes against ourselves. People to tell us we look thin when we are overeating, people to tell us we look gorgeous when we're spent, and people to tell us we're making sense when we're not. With friends like these, we're almost put off when people decide to actually be honest. The past few years, I have found great solace and kinship in the above thoughts and words expressed by fashion publicist, author, and founder of PR firm People's Revolution, Kelly Cutrone. They've helped me cling to who I know I am on those days I have felt my worst just being who I am in this world. Especially those days I felt anything but what the world wanted me to be. I think every nurse needs to read her books, especially Normal Gets You Nowhere. Read it at least 100 times, and keep reading it every time you doubt who you are or when you're trying to just get by being like everyone else so you blend into the background. When it comes to nursing and who you are in the profession, you have to ask yourself the following. Do you believe as nurses we spin our truths? Are you part of the illusion, or do you insist on being real? Look at the celebrities in the following pictures that were taken from the Heart's Truth fashion show. If you notice, the women are tied together in 3 ways. They're wearing red, they're all there for a common purpose, and they're all wearing dresses. If you look at each celebrity, they flaunt their own style of dress, their own pose, their own unique smile, and I'm quite sure their own walk. There is no hiding or suppression of self, voluntary or involuntary. They revel in their individual beauty and are proud to display it. Do you see the profession of nursing in this way? If so, how? And if not, why? Kelly goes on to urge that it's not enough to just listen to your inner voice and ask yourself the hard questions about who you are and what you believe. Eventually, you need to get strategic about refining and communicating to others who you are and what you believe if you want to succeed. Don't blend in. The truth is, most of us are trying to do exactly that. But if you think about it, the people who are actually making a difference in the world are people who are not like everyone else. The best brands stand out. I believe these people become successful because what they are selling is authentic and consistent. They find jobs that are aligned with their skills and passions, and they bring their true selves, idiosyncrasies and all, to work day after day. Everyone is selling something these days, and if you don't have a clear point of differentiation, something that makes you special, unique, effective, you won't get far in any competitive industry. All celebrated brands have a point of differentiation. It's time to figure out what you are selling and how you are going to make people want to buy it. Your point of differentiation doesn't need to be edgy or groundbreaking. It just needs to be you. So how do you find your point of differentiation? The first step is to stop trying to convince yourself and letting others convince you that you're something that you're not. This all goes back to the absolute necessity of following your dreams. If you don't know exactly what fits into your life and what doesn't, the best way to figure it out is to follow your inner voice away from what feels wrong and toward what feels right. These experiences won't always take you on an express train to your true purpose and calling in life, but they'll teach you the lessons you're supposed to learn. Successful people and compelling brands are highly specialized. They do one thing, and they do it in a better, more interesting way than everyone else. In yet another excerpt from her book, Kelly goes on to describe her own personal brand. I describe my brand today as renegade, strategically kooky, ballsy, bohemian, intuitive, ruthless, and loving. An essential quality of my brand is that people who don't know me often just write me off as a crazy bitch. But am I? Everything I do is well thought out. Sometimes I speak in a loose, associative manner, stunning people and entertaining them into giving in to what I want, even if they have no idea what I'm saying. People we perceive as having great individual style have found things that represent their unique inner world outwardly. They are in their truth. They've done the work, and they know who they are and what fits on them and what doesn't. The people who succeed are often not just the people with the best articulated brands. They're the people who respond to rejection by brushing themselves off and moving on, again and again. Each one of us who walks the nursing runway has a one-of-a-kind swagger, a one-of-a-kind pose and attitude, a one-of-a-kind pivot or pop of the hip. We all wear nursing and model nursing in different ways, even though we're included within the category of the profession. We're all different ages, ethnicities, and have different values and beliefs. And yes, we even nurse differently. Have you ever heard of branding? Each one of you out there is a brand of nurse. You are your own brand. You are a runway model for nursing. Unfortunately, we tend to expect that as nurses we're supposed to think the same and act the same and follow along behind everyone else in the same way. Those who are different are often ostracized or left out of the group dynamics. Each and every one of us has a special gift or talent we bring to the runway, something that has the ability to enhance the overall brand of nursing. Be proud of that and walk tall. Use that hallway and practice that walk. But don't make each other feel less than who they are because they nurse differently from you or present a different view than you, because that is the beauty and richness and depth of nursing. If we are to grow with one another and help the profession's brand get even better, we must celebrate and harness each other's differences, not criticize or judge, because you never know what you could be missing out on. So create those moments yourself by finding ways to celebrate your coworkers and revel in the sparkle of what you learn from those who choose the nursing path less traveled by being their own self. It doesn't take much to find out something about the people you work with that you never knew before, or to learn something from them, a new way of doing something that you'd never considered. We're all fantastically phenomenal and have something that is one of a kind to bring to this profession and to this world, but only when we allow ourselves and each other to flourish intentionally with purpose and passion. Ultimately, it's when we make that choice that we are at our best as humans and as nurses.